This is the first of a series of lectures about healthcare system delivery in the United States. This first lesson will talk about what kind of healthcare system we actually have here in the United States. The goals of this lesson are to identify the attributes that define a healthcare type of system, then to review the kinds of different models that exist in the world, and then to see where the United States healthcare system fits into this classification scheme. First of all, let's just talk about the types of healthcare services so we know what this system is supposed to be delivering. First of all, there is preventive care, and the setting for that are these domains, the public health programs, community. There's primary care, delivered in offices and clinics or by patients more and more. Specialized care, chronic care, which is becoming a huge issue as the baby boomer population bubble ages, and the settings for those kinds of care. Long-term care, subacute care, which is outside of the acute care hospital, hospitals themselves. Rehab care is a big thing, rehabilitation departments, home health, etc., and end-of-life care, especially the inefficiencies of end-of-life care as they occur in the acute care setting, where almost 50% of the healthcare dollars are spent in the last 3 to 6 months of life. So let's talk a little bit about what defines a healthcare model. There are three main attributes. How is healthcare financed? That is, where's the money come from? How is healthcare delivered? That is, who owns the provider system? Who owns the hospitals and the physician networks and all the other services we just saw? And how is healthcare insurance managed, which really means who pays and where's the money flow and who makes money in the system. There are three basic models, numbers 1, 2, and 3 here, and then there's the others, which are not really systems. So we have national health systems, national health insurance, socialized health insurance, and these are defined by those three attributes on the previous slide. Then there's free market insurance, and then there's out-of-pocket insurance. So the first one, a national health system. This is a system of care where the government collects its taxes to finance the system. The care is delivered by government or public employee providers. The government owns the hospitals. Therefore, see these two bullets right here. The care is delivered by the government, right? The government owns the system. The government owns the facilities, and the providers work for the government. The government sets the reimbursement rates and pays for care. It's a single-payer system, and examples of this are Great Britain's national health system, and also many of the countries in Europe have the same system, as does Canada. So, I think I jumped a slide. How does that compare to national health insurance? In this system, the government collects taxes to finance. Where's the money come from? It comes from taxes. The care is delivered by private providers. The hospitals are either not-for-profit, or they are not-for-profit, but they're run by community or public boards. So therefore, the providers don't work for the government, and the facilities are not government-run facilities. But the government sets the reimbursement rates, and they pay for all the care, so it's a single-payer system. And examples of this are Canada's healthcare system. Now, the third type of system is called socialized health insurance. Socialized is a really tough word here in the United States, but in this system, laws are used to force employee and employer contributions, so there are taxes. The care is delivered by private providers and private hospitals, and they can be for-profit or not-for-profit. And private non-profit insurance funds collect premiums and pay for the care. So laws get the money into the system. There's not a government-owned providers or hospitals or clinic system. The money is allocated not by the government. There's not a single payer system, but it's run by not-for-profit insurance funds that are authorized by the government. And the government sends the reimbursements, but there's some flexibility as companies compete with each other for patients and can negotiate different reimbursement rates. And this is, Germany championed this. This is sometimes called the Bismarck system, but it's used in a lot of countries, in developed countries. And it's the system that Mitt Romney put into place in Massachusetts, which became the model for the U.S. Affordable Care Act reform, but which eventually became politicized and turned into a mess, as we all know. Now, compare that to the free market insurance system. In this system, individuals or employers purchase their insurance in the marketplace. The care is delivered by private providers and private hospitals, and they might be for-profit or not-for-profit. Private insurance companies, and they can be for-profit or not-for-profit, collect the premiums and pay for the care, and the insurance companies determine the benefits and reimbursements. So there's no single payer, there's no government taxes, and the system is not really influenced by the government. And this is really our employee-based or typical insurance system or healthcare delivery system we have here in the United States. Now, compare those to out-of-pocket, no system here, no system in place, there's no financing, nobody's got an organized system for collecting money, there's no government involvement, there's no insurance plans, patients just pay out of pocket. And they go to private providers, they go to private hospitals or clinics, they might be private or public, and there's no regulation of fees or reimbursements. And this is typical of countries that are third world or poor or developing, Cambodia, India, Egypt, many other countries. So what does the United States system look like? Well, we're really a pluralistic or hybrid system of healthcare systems, if you will. We have a private system, and typically it's employer-based, or individuals can buy these insurance plans. The financing, usually employer-employee share the premium costs. There's a lot of out-of-pocket costs for deductibles and co-payments, or an individual buys it themselves. The insurance is commercial insurance, might be managed care. Individuals might buy it from insurance companies. They may buy a managed care plan. The delivery system, it's full choice of providers within limitations. There are networks where the incentives to work within the network save money for the patients. You otherwise can go outside the network. The choice is restricted in managed care organizations, but that's a subset of this. And full choice of providers when you buy it out of pocket, unless you buy a managed care plan. The payments are delivered by the insurance company. Examples are Blue Cross Blue Shield, and that might be managed care. But the United States also has a totally public component to the system, and Medicare and Medicaid are examples of that. And Medicare, Part A is hospital payments, Part B is clinics, lab tests, and professional fees and outpatient payments. And this system is financed by the federal government. There are some copays and premiums in some of the systems, not in Part A, but Part B. Medicaid is run by the feds and the state, but it's all public sponsored. There's also a VA system, which is public, where the federal government owns the system and pays for it. The insurance is federal government. The delivery system may be private for Medicare and Medicaid, or it may be government sponsored if it's for the VA system, for example. Payments are determined by the government. The government puts the money out through private insurance companies if there's a managed care plan involved. And in the VA system, the government pays for everything. So what do we really have here in the United States? Well, this hybrid system is really a combination of free market insurance which is for people who buy their insurance through the federal government. The hell was that? Sorry about that. So, in the commercial market or employee sponsored, it's free market insurance where you buy it from private companies and the government has nothing to do with it. If you're in the military or the VA system or you're a Native American, we're like the UK in that we have a national health system where the government owns the system. The physicians and other providers work for the government. The government owns the clinics and hospitals. If you're a Medicare beneficiary or Medicaid, we're more like Canada's national health insurance system, where the government collects the money, the government pays for care, but you can go into the private sector for the care you receive. Or if you're like the 50 plus million Americans who have no insurance right now, we're like a third world country. We're like Cambodia. You pay out of pocket, you do what you can, and too often you go into bankruptcy. So that's an overview of the healthcare system types and where the United States fits into it.